Most of us think heart attacks happen suddenly, a sharp pain, a collapse, and someone rushing to help. But what if it happens when you're completely alone, when there is no one to come to your aid? The truth is, thousands of people over 60 experience this exact situation every year, and many don't survive it. Not because they didn't have time, but because they didn't know what to do in those first few critical minutes. In this video, you'll learn 10 crucial steps you can take to stay alive when a heart attack strikes and you're all alone. These small actions can keep your heart beating long enough for help to arrive, and they might just be the reason you survive. Here's something most people don't realize. Surviving a heart attack isn't just about luck or medical help. It's about what you do in those first few minutes. A heart attack cuts off blood flow to your heart muscle, and the longer it lasts, the more damage it causes. But if you act fast and stay calm, you can keep yourself alive until help arrives. So let's go over the 10 life-saving steps that can help you survive a heart attack alone after 60 and why each one matters. 10. Recognize the early warning signs. Here's the thing most people get wrong about heart attacks. They think it's always that movie moment. You know, someone clutches their chest, gasps and falls to the floor. But in real life, it's rarely that dramatic, especially for people over 60. A heart attack often starts quietly. You might just feel a little tired or slightly off. Maybe there's a bit of pressure in your chest, like you ate too much or need to burp. You might feel short of breath walking across the room, or notice a strange pain that moves to your arm, neck, jaw, or even your back. Some people just feel dizzy, sweaty, or anxious for no reason. The scary part? Many people ignore these early warning signs because they don't feel like a heart attack. They tell themselves it's just stress, indigestion, or maybe fatigue. But that delay, those few minutes of waiting, can be the difference between survival and tragedy. Your heart is a muscle, and when a heart attack begins, it's being starved of oxygen. Every minute you hesitate, more muscle tissue starts to die. That's why recognizing these early signs and taking them seriously is the first and most important step to staying alive. So if something doesn't feel right, even if it's mild or confusing, don't brush it off. Sit down, stay calm, and get help immediately. Because here's the truth. Your body always sends warning signals before it completely shuts down. You just have to listen. The faster you notice, the faster you act, and those few seconds could save your life. Sometimes, survival starts with simply paying attention. 9. Avoid eating or drinking anything. When most people start feeling unwell, their first instinct is to reach for something. A glass of water, maybe a snack, or even medication. It's almost automatic. After all, when you're dizzy or short of breath, a sip of water feels harmless, right? But during a heart attack, that simple action can actually make things worse. Here's why. When your heart is in distress, it struggles to pump blood properly. That means your body, especially your brain, isn't getting the oxygen it needs. You might feel lightheaded, shaky, or like you're about to faint. If you drink or eat anything at that moment, there's a chance you could choke if you suddenly lose consciousness. Even water can become dangerous because your body's reflexes slow down when oxygen levels drop. And if emergency responders arrive while you're unconscious or semi-conscious, having food or liquid in your system can make it harder for them to give you the help you need quickly, like CPR, oxygen, or certain medications. It's one of those small details that most people don't think about until it's too late. But it matters a lot. So, if you ever feel symptoms of a heart attack, chest pressure, breathlessness, or that strange, heavy feeling, resist the urge to grab a drink or snack. Keep your airway clear and your body calm. Remember, this isn't the time to fix how you feel. It's the time to stay alive until professionals arrive. Think of it this way. Every move you make either helps your heart recover or makes it struggle harder. By avoiding food or water, you're removing one more thing your body has to deal with and giving your heart the best chance to keep beating. 8. Call emergency services immediately. A heart attack is like a fire in your chest, and every minute you delay calling for help, is like letting that fire spread. The longer your heart is deprived of oxygen, the more muscle damage happens, and the harder it becomes to recover. Doctors call this the golden hour, that first critical window when fast action can mean the difference between survival and a fatal outcome. So don't wait it out, and don't try to convince yourself it's nothing serious. Many people who lost their lives to heart attacks actually felt something was wrong. They just didn't want to bother anyone or call too soon. If you're alone, grab your phone and dial your local emergency number immediately. Don't text, don't Google, just call. Even if you're unsure it's a heart attack, the operators are trained to guide you step by step while help is on the way. And here's something else to know. Calling early doesn't just get you medical attention faster, it prepares rescuers before they arrive. They'll know what to expect, what equipment to bring, and how to reach you quickly. Your life is worth the call. So if your body whispers that something isn't right, listen. Pick up the phone. Don't wait another second. 7. Chew an aspirin. One of the simplest things you can do during a heart attack doesn't involve fancy machines or medical training. It's something you can do right at home in just seconds. It's chewing an aspirin. Yes, that small white tablet sitting in your medicine cabinet can actually save your life. Most people think of aspirin as something you take for a headache or muscle pain, but during a heart attack, it does something far more powerful. When a heart attack begins, it's usually because a blood clot has formed in one of your arteries, the tubes that carry blood to your heart. That clot blocks oxygen from reaching part of your heart muscle, and the longer it stays there, the more damage occurs. Aspirin acts like an emergency brake. It thins your blood and stops the clot from growing, giving your heart a fighting chance to keep pumping until medical help arrives. But here's the important part. You should chew the aspirin, not swallow it whole. Chewing helps the medicine get into your bloodstream faster, often within minutes. When you swallow it, your body has to break it down in your stomach first, and that delay could cost you precious time. So if you ever feel that crushing pressure in your chest, or pain that spreads to your arm, jaw, or back, and you suspect it's a heart attack, take one regular aspirin, 325 milligrams, and chew it slowly. Don't wash it down with water, and avoid coated or extended release versions because they take too long to absorb. If you're allergic to aspirin or your doctor has told you not to take it, skip this step. But if you can take it safely, that one tiny pill could make all the difference between life and death. 6. Loosen tight clothing and sit upright. During a heart attack, one small move can help your heart work a little easier. Sitting upright and loosening anything that feels tight. It sounds almost too ordinary to matter. But here's the truth. How your body is positioned when your heart is in distress affects how well it functions. When you sit upright, you allow your lungs to expand fully. This gives your body more oxygen and reduces the strain on your heart as it tries to pump blood through your system. Lying flat, on the other hand, can make it harder to breathe and increase pressure in your chest. Now think about what you're wearing. A tight belt pressing into your stomach, a shirt collar hugging your neck, a bra strap that feels snug across your chest. These small things can worsen the feeling of pressure. So, unbutton your shirt, loosen your belt, take off that tie, and let your chest and abdomen move freely. The goal is simple. Give your body the space it needs to breathe and circulate blood without extra restriction. If you're with someone showing signs of a possible heart attack, maybe they're clutching their chest, sweating or feeling dizzy, help them into a comfortable sitting position. Ideally, they should sit on a chair or the floor with their back supported by a wall or cushion. Keeping them upright helps the blood flow from the heart to vital organs and prevents fluids from building up in the lungs. Here's another reason this matters. The heart is a muscle that needs oxygen to function properly. By sitting up and relieving external pressure, you're helping that muscle do its job a little more efficiently until medical help arrives. It might look like a small adjustment, unbuckling a belt, loosening a shirt, sitting up straight, but those seconds count. These actions make breathing easier, reduce chest pressure, and buy precious time for the heart to keep beating strong. Sometimes the smallest moves can make the biggest difference. 5. Cough strongly if you feel faint. You suddenly start feeling lightheaded. Your chest feels tight, your breathing becomes shallow, and there's that strange wave of dizziness that makes you think you might pass out. In that moment, one simple but powerful action can help: coughing. Yes, you read that right. Coughing. Deep, strong, repeated coughs can actually help keep your blood moving when your heart starts to falter. Here's what happens. During a heart attack, your heart's rhythm may become irregular, which means it might not be pumping blood as effectively as it should. That's when oxygen levels in your brain and body begin to drop, and you start feeling faint or weak. By taking a deep breath and coughing firmly, you temporarily increase pressure inside your chest, and that pressure helps your heart push blood through your body for a few crucial seconds. Think of it as giving your heart a quick assist, like a manual restart. Every strong cough squeezes your chest, forcing blood out of the heart and helping to keep it pumping until normal rhythm returns or help arrives. Now, this doesn't mean you should start coughing uncontrollably. The goal is steady, purposeful coughs, like this. Take a deep breath, hold it for a second, then give a deep, strong cough from your chest. Repeat this every 2 seconds or so if you feel faint or your vision starts to blur. You're not just clearing your throat, you're helping your body stay alive. It may sound too simple, but countless emergency experts recommend it as a last resort measure when you're alone and feeling faint from chest pain. Think of it as your body's temporary backup plan, a quick way to keep oxygen flowing when your heart rhythm goes off track. In those critical seconds when every heartbeat counts, one deep breath and a strong cough might just give your heart the rhythm it needs to keep you alive. 4. Unlock your door and keep your phone and ID nearby. What if you've already called emergency services and they're on their way, but your door is locked? The ambulance pulls up, the paramedics rush out, but now they're stuck outside, trying to find a way in while every second feels like an hour. That's why one of the smartest yet most overlooked steps you can take during a heart attack is unlocking your door and keeping your phone and ID within reach. It might sound simple, even trivial, compared to everything else you're dealing with, but in emergencies, small things can make a massive difference. If your front door is locked, paramedics may have to break it down or wait for someone with a spare key, and those lost minutes could be the difference between survival and tragedy. By unlocking your door before things get worse, you're giving rescuers immediate access to help you faster. Now, your phone is your lifeline. Keep it close, not just to talk to emergency operators, but in case they need to call you back for directions or updates. Sometimes they might ask you to describe your symptoms or guide you through what to do next. Having your phone in your hand or beside you ensures you don't waste precious seconds trying to find it when your strength is fading. And your ID? That's more important than most people think. If you collapse or become unresponsive before help arrives, your ID helps paramedics identify you right away. It allows them to quickly access your medical history, allergies, and age, all of which can influence the kind of care they provide on the spot. So, as soon as you sense that something serious is happening, before your symptoms worsen, unlock your main door, keep your phone nearby, and place your ID where rescuers can easily find it. Think of it like setting up a rescue path before things spiral out of control. You might not be able to control what happens inside your body during a heart attack, but you can control how easy it is for help to reach you. Sometimes, that simple act of preparation can save your life, literally, before a single medical tool even touches you. 3. Take slow, deep breaths. When a heart attack strikes, your body instantly goes into panic mode. Your breathing gets shallow, your chest tightens, and fear takes over. That's your body's natural fight or flight response, but in this moment, fighting actually works against you. What your heart needs most right now isn't panic, it's oxygen. And the best way to get it is through slow, steady breathing. It might sound too simple to matter, but taking deep, controlled breaths can actually help your heart survive those critical minutes. Here's why. When you panic, your breathing speeds up and you start taking short, shallow breaths. This means you're pulling in less oxygen and building up carbon dioxide, which makes your heart work even harder. But when you slow your breathing, you give your body the oxygen it desperately needs while also lowering stress hormones that can worsen the attack. Try this. Inhale slowly through your nose for about 4 seconds. Hold that breath for a brief moment, then exhale gently through your mouth for another 4 seconds. Feel your chest rise and fall with each breath. Steady, calm, controlled. Repeat this rhythm again and again. Each slow breath does more than just calm your nerves. It helps your blood carry oxygen more efficiently to your heart and brain. Think of it like easing the pressure on an overworked engine. By breathing deeply, you're giving your heart a little breathing room, literally and figuratively. And here's something fascinating. Studies show that deep breathing activates your body's vagus nerve, which helps slow your heart rate and lower blood pressure. That means every calm breath you take isn't just relaxing you. It's helping your heart regain rhythm and balance. You don't need any equipment, no medicine, no fancy technique. Just air, focus, and a little control. Even if you're scared, and it's perfectly okay to be, your breathing is one thing you can still command. So, in that moment when everything feels out of control, remember this. Your breath is your anchor. Every slow inhale gives your heart strength. Every gentle exhale releases tension. Keep breathing, deeply, steadily, and with purpose. Sometimes survival starts with something as simple as remembering to breathe. 2. Stay as calm and still as possible. When a heart attack hits, your first instinct might be to move, maybe to stand up, pace around, or even try to walk it off. But that instinct, though natural, can actually be dangerous. In fact, one of the most important things you can do to survive a heart attack alone is also one of the hardest. Stay completely still and calm. Here's why this matters so much. During a heart attack, one or more of your heart's arteries become blocked, cutting off blood flow to part of your heart muscle. Your heart is struggling to pump, and every extra bit of movement makes it work even harder. Think of it like a car engine running low on oil. If you keep revving it, it's only a matter of time before it burns out completely. When you move, whether it's trying to walk, grab something, or change positions, your muscles demand more oxygen. But your heart can't supply that oxygen because it's already in distress. That mismatch increases the damage to your heart tissue. In simpler terms, the more you move, the more strain you put on an already weakened heart. So what should you do instead? The moment you recognize that you're having a heart attack, sit or lie down in a comfortable position, preferably upright with your back supported and your knees slightly bent. This position helps blood flow more easily and makes it easier to breathe. Then, focus on staying as still as possible. Don't try to get up for water, don't pace, don't fidget, just breathe slowly and wait for help to arrive. Studies have shown that people who remained calm and still during a heart attack had better outcomes and fewer complications than those who panicked or kept moving. It's simple science. Less movement means less oxygen demand, which gives your heart a fighting chance to stabilize until medical help gets to you. You can't control when a heart attack happens, but you can control how your body responds in those first few critical minutes. 1. If possible, alert someone nearby. If there's one thing you should never do during a heart attack, it's face it completely alone. Even if you've called emergency services, alerting someone nearby, a neighbor, family member, or even building security can make all the difference between life and death. Here's why this step matters more than most people realize. During a heart attack, your condition can change fast. One moment you're conscious and talking, the next, your breathing might slow or you could lose strength. Having someone nearby means there's an extra pair of eyes, hands and ears to keep you safe until help arrives. Let's say you live in an apartment or a house close to others. Call or text a trusted neighbor. If your voice is weak, try using short, clear words like heart attack, call ambulance. If you're in a gated community or apartment complex, alert the security or caretaker. They can unlock gates, direct paramedics, and ensure no time is wasted figuring out where you are. If you live alone, make it a habit to keep your phone nearby and emergency contacts easily accessible, maybe even on speed dial. You can also share your location with a trusted friend or neighbor using your phone's GPS feature so they can find you quickly. Remember, surviving a heart attack isn't just about what you do, it's also about how fast others can reach you. Don't try to be a hero, ask for help. The person next door could be the reason you make it to the hospital in time. Every second matters. Surviving a heart attack alone isn't about strength, it's about strategy. Every small action you take, from recognizing the early signs to staying still and calling for help, buys your heart the time it needs to recover. Remember, your body is always speaking. Chest pressure, dizziness, or sudden fatigue are signals you should never ignore. Acting fast, staying calm, and preparing ahead, like keeping aspirin and emergency contacts close, can make all the difference. Your heart has carried you through a lifetime of moments. Protect it by knowing what to do when every beat counts. Knowledge isn't just power, it's survival. If this video helped you understand what to do in an emergency, make sure to like, subscribe, and turn on the notification bell, because every week we share practical, science-backed health tips to help you live longer, stronger, and smarter. And please share this video with someone over 60 or anyone living alone. It might be the video that saves their life one day. Stay safe, stay aware, and take care of your heart. It's the only one you've got.